is about organizing working class people, whether it's around our healthcare, human rights, whether it's around housing, or whether it's around food. Look at my notes here. Just recently, we were up in Newport for a national day of action around Medicaid, with all the organizing that's going around there around the hospital closure up in Newport. As probably we all know, there's a lot of organizing to take our human rights away from us, whether it's on the national or a local level. The big, beautiful bill for billionaires that was recently passed, cutting SNAP and Medicaid benefits. But this didn't start with the current administration. Under Biden in 2023, Medicaid was slashed, and that's why we are in it for the long haul. We're gonna have a few stories from people involved, and then we're gonna open it up for others that want to tell their stories. And I think that's what it's gonna look like, as well as food from People's Kitchen. All right. Quinn or Stony? Can I get a Quinn or Stony? When do you want to jump in first? Yeah.
Thank you. Hi, everyone. My name is Quinn. I've been a member of the Vermont Workers Center since 2019. I got involved with the Workers Center because I, for a long time, received disability benefits and was put on Medicaid and Medicare. As a result of that, it helped me in just far out ways with being able to pay for my medical bills due to my mental health status of being bipolar. Before that, was living in a shelter waiting for disability to kick in because I was unable to hold a job and unable to have a job while waiting for disability, which is beyond fucked up. I was in a place where I was desperate, poor, and didn't know another way out, and the disease of addiction was taking deep hold of me. I almost died quite a few times in 2017. Luckily, due to my medical team, I have been able to sustain 4 years clean and recovery. Thank you. And I have been able to live a more fulfilling life. These days, I'm afraid of losing my Medicaid because, well, if it gets cut, I'm gonna have to choose between my medications and the life I hold so dear. But that life is contingent on those medications. If I become manic or extremely depressed again, I won't be able to hold down a job. I won't be able to take care of myself or be there for the ones I love. So I implore you to get up, do something about it like the rest of us are today, and get involved either here with Fareed at the People's Kitchen or as part of the Vermont Workers Center. I just remind yourself that you only get what you organize to take, and that we're stronger together than we are isolated apart. So thank you so much.
Thank you, Quinn. Yes, as the National Coalition for the Homeless say, we are, no, the National Coalition, yeah. We only get what we're organized to take. Yes. Also, before our next speaker, you're good. Let me know if it's too loud, too soft, and let Kate know if you don't want your picture taken. Also, if you want to talk and you don't want to be on camera, we can definitely do that. So, Stony, Volney. Yeah.
Couldn't get out of it. Hi, everyone. I'm Stoney Thompson, and I'm proudly a vegetable farmer in Huntington. And I'm proud to get up every day before dawn and grow healthy food for my community. And despite working 60 to 80 hours a week, I rely on Medicaid because our food system is rigged so that corporations and Wall Street get rich while farmers and farm workers barely get by and eaters get sicker. Okay, thanks. And I don't say that about, like, I work 60 to 80 hours a week and rely on Medicaid to in any way imply that I'm uniquely deserving of health care. I think that everyone deserves health care. I think that it's a human right. It's something that we all deserve by virtue of being human. But nonetheless, I do chuckle when I hear, billionaires and politicians talk about Medicaid recipients being parasites or lazy, because I know they wouldn't last a day in my shoes. I know they wouldn't last a day in anyone's shoes here. They're mostly, the best thing they're good at doing is kind of sitting back and trying to divide us and pit us against each other while they throw a few crumbs at us. So I rely on Medicaid mostly for mental health services. Farming is an incredibly stressful profession. Like, farmers are uniquely at risk for suicide. And so seeking out mental health services has been really a huge boon to my being able to stay in the business and have a viable business. I also say this, I rely on Medicaid for gender-affirming care because I'm transgender. There was recently a bill that came out of like a Health and Human Services appropriation bill, which basically stated that no federal dollars would go to gender-affirming care, which would destroy a lot of people's lives in my position. And regardless of what you think about trans people, I think we need to see this tactic for what it is, which is an attempt to try to divide people into deserving or undeserving, when we actually all deserve health care, and what services you get are a conversation between you and your doctor. And so I just kind of want us to all come together and say that, like, we all deserve this. We should have it. Let's do it. Let's fight for this.
Thank you, Stoney. All right, can I get a Volney or a Peter? You're next, Volney.
Hi, I'm Peter with the Vermont Workers Center and a member of the National Educators Association. As a Medicaid recipient for many years, I know firsthand how life-changing the coverage provided by Medicaid can be. At times when I was out of work or not making enough to live, Medicaid was my lifeline and enabled me to get the essential care I needed to be here today. I struggle with addiction and other mental health challenges. Without that coverage when I needed it most, I can't imagine how I would have been healthy enough to be in the position I am today. Medicaid and Medicare have been under attack since they were established, but even more so recently. The Trump administration and the Biden administration before it have worked tirelessly and without regard for poor and working class people when pursuing their dangerous and violent policies. The Biden administration was responsible for the single largest Medicaid purge in history, and now the Trump administration is working even harder to cut the benefits that people depend on for their health care. At a time when the divides between the rich and the poor are increasing every day, poor and working class people need these benefits more than ever. Not only should Medicaid recipients not be forced to suffer from these cuts, Medicaid, SNAP, and other benefits must be expanded to improve access to health care, housing, and food to provide a high quality of living for all people. 25% of Vermonters rely on Medicaid for health coverage, and the impending cuts to it will take an unimaginable toll on Vermont. Vermonters are already suffering enough, and our healthcare systems would struggle immensely to withstand the effects of the cuts made by the Trump administration. With the cuts made by the federal government, The state of Vermont's inaction on implementing Act 48's mandate to provide affordable health care for all, and the endless blood money profiteering from health insurance and pharmaceutical companies, it should be clear that no one is coming to save us. It is up to us to save ourselves. We can never waver in our demands to the rich and the powerful who steal from the working class to keep us sick and their profits flowing. We cannot let them continue their terroristic campaign against poor and working class people. The nonviolent Medicaid army is taking radical action all over the country to make sure the powers that be can never ignore us again. Please join our army of the poor and dispossessed. The future of healthcare depends on how effectively we organize against these dangerous policies in these uncertain times. You only get? Yes. All right. Thank you.
Thank you, Peter. Woo! Volney, you're up for real.
Hey everybody, my name is Volney. I'm a member of the Vermont Workers Center, also here on behalf of the People's Kitchen and Ishtar Collective. Out here, you know, since the pandemic, we've only seen disparities become greater and greater, and we're out here pretty much all week feeding folks, and those lines are only getting longer every year. Since the pandemic, we've seen them get longer and longer. We've seen the divide between the folks that have and the folks that don't have get more and more apparent. They're taking away our health care. They're taking away our freedom to go to school where we want to. They're taking away our freedom to express ourselves how we want to. And that's not political. That's just straight up violence. You know, they're coming for us being the most vulnerable, the poorest of our country. Those folks that are here, like not only the backbone, like labor-wise of our society, but the folks that we should be protecting. They're coming for us nonstop, and we need to join together. I think right now is a time as rough as it is. I think it's a moment where we should be seeing the lines of division being more and more apparent and using that division to come together and against the power holders and actually hold them to the promises that they've made us over the past 10 years, 20 years that I've been paying attention. I see all kinds of folks who are doing the work from different angles, and I think that is amazing. I think we need to build more bridges, more ways to like support each other in this work, not just in this work, but in this time of need. And I want to thank Fareed for continuing to do all this stuff that he's been doing. And can we get a second to say happy birthday to Fareed real quick? Can we just celebrate him for 1 second? Because he won't do it for himself. But celebrating everything that he's been doing and the tireless efforts that he makes, that we all make to make sure that our community is supported, to make sure that we're all being heard, to make sure that policies here in Vermont are representing us and not punishing us for just being poor. And I want to give it back to Nick. Thanks, y'all.
Thank you, Volney. Forward together.
Not one step back.
Forward together.
Not one step back.
Forward together.
Not one step back.
Yeah, okay. So now we're going to open it up. If people want to share any healthcare stories, 2 to 3 minutes, come up to the mic and introduce yourself. I'm not good at rambling up here. Yeah.
Hey folks, thanks for being here. I don't have a personal anecdote to share, but I can just see in my own life, in my own small sphere of people, my family and friends, how indiscriminate healthcare challenges can be. It touches everybody from all swaths of life. And I honestly believe this is the first victory we're going to see as working people is Medicare for all, Medicaid for all. And it's because, you know, people like you, people like us who show up and write our congressmen and come out on the streets and raise awareness, you know, sharing our stories about how, you know, a genetic roll of the dice shouldn't mean we're condemned to a life of struggle and poverty because we can't afford our medical bills. So I just want to thank everyone for being here, encourage others to stand up and share their stories, because the more stories we have, the more united we can be, you know. All right. Thanks, guys.
Thank you. Yeah. Anybody else? I know I worked in this area as a social worker for most of my adult life, and I'm at the point where the fact that I'm in this bind that the amount I'm forced to work to be able to afford health care is making me sick. And so, and this happens to all of us, where we're forced to sell our labor to get health care or not, and the amount of work that we have to do makes us sicker and sicker. Anybody else? If we turn the camera off before it comes up, if we turn the camera off, does anyone else want to speak? Our closer.
It's good to be here with you all. I think my speech is about 4 different speeches, so bear with me. I just want to start with my personal story. My story is that I became disabled, and that was in part due to workplace abuse at one of the designated agencies. Not going to name any names, but they do target union activists there. And part of my disability also stemmed from the trauma, actually, of being an activist, being targeted by ICE and Homeland Security for taking a stand and witnessing police brutality. Real democracy is a necessary precondition for the health of all of our bodies. I went to the system for help with chronic pain, and I faced medical gaslighting and was unable to find adequate mental health care. I applied for disability and found that the lawyer was able to take 19% of my back paid benefit that was money that I had earned. I would have not minded paying the lawyer, but actually I was the one who did all the work and provided all the proof. Even after working with many different case managers, doctors, and lawyers, no one mentioned to me during that process that being placed on SSDI means they automatically put you on Medicare. The first few months of being on disability was an incredibly stressful time, and I needed a lot of help. I'm now spending anywhere from 30 to 40% of my low income on Medigap and supplemental health, dental, and vision plans. While this has gone on because of the strength of activism in our community, because of all of you, I've been able to use the time and energy I have to continue to speak out against environmental injustice, specifically clean water issues, against racism, specifically defunding police, and against militarism in the form of the damaging impacts of the F-35 here and abroad. Systemic change is needed to create freedom from the coercion of being forced to pay the military's bills rather than for our own basic human needs. In the current climate, it is our duty to unite and speak up. Healthcare is a human right, and health begins in our bodies and in our environment. The elite rule in Vermont as in every other state, and they like that their warplanes and police departments protect wealth, comfort, and privilege. They tone police us when we speak out. They say we are uncivil when our protest is much more peaceful than the harmful impact of corporate greed and the violent impact of the military-industrial complex. Collectively, we stand together, knowing we are not alone, lifting up each other's voices in our shared struggle for peace and justice. So I just want to explain a little bit about why we say Medicaid for all and we do not say Medicare for all. So what's wrong with Medicare? What's wrong with Medicare is that I'm paying $185 a month for basic Medicare. Then that does not cover dental, so I have to pay another $45 a month for dental. That does not cover my prescription drugs, so now I have to pay another $20 a month to V-Farm. And then there's a Medigap plan I need to buy, that's $62. Medicare does not cover naturopath services, so when you retire, you won't have access to a naturopath unless you pay for it out of pocket. I also live in a town that does not have ambulance service in Heinsberg, so I could sign up for a subscription to the Richmond service, which if I'm lucky, it will get there in 15 minutes, but it's more likely to get there in 30 or 45 minutes. In addition, this year I learned that my personal information was sent by Governor Scott to the feds. My name, my date of birth, my social security number, and my address. That was not very comforting to think that certain individuals have access to my personal information. I'm spending about $883 a month total on my health care needs right now, which means about 44% of my income is going to medical expenses. Sorry about that. Meanwhile, the U.S. is spending $17 billion annually to maintain, operate, and upkeep the F-35 program, which is harming children's development in local towns due to noise toxicity and killing and maiming people in imperialist wars. The Vermont Air National Guard has contaminated the Winooski River and local water supplies with PFAS forever chemicals that bioaccumulate and harm humans and other living things. There is no safe level of PFAS exposure, and PFAS are regulated in the parts per trillion. In 2021, my Clean Water Coalition measured PFAS in the salmon hole of the Winooski River and found 145.2 parts per trillion of PFAS compounds. On June 20th of 2024, the Vermont Air National Guard's poorly maintained system malfunctioned and spilled 800 gallons of PFAS firefighting foam into the Winooski River. Officials quickly covered this up as Vermont's official policy on pollution is dilution. The Centers for Disease Control recommends that doctors test all patients for PFAS. 90% of Americans have been exposed. Vermont's policy is dilution, but the human body cannot dilute these contaminants. Forever chemicals bioaccumulate. Authorities closed beaches briefly in the wake of the Air Guard's negligence in June of 24. However, as we know, the Intervale floods regularly, and farmers there do not deserve the onslaught of toxic chemicals, and those chemicals are taken up in plants. So what medical problems are associated with PFAS? Increased risk of diabetes, endocrine disruption, pregnancy issues, developmental issues, neurodevelopmental issues in children, preeclampsia, high cholesterol, kidney, testicular, and liver cancer, reduced immune system function, and behavior and learning issues in children. And our healthcare professionals are not educated or prepared to confront the effects of these toxins. I asked my doctor for a PFAS test and got a blank look. This is at the community health centers. Folks may know that Bernie Sanders is not the people's hero he claims to be, as he supports the F-35 program and traded his silence for the community health centers, which are not evaluating patients for PFAS exposure. When even our most liberal politicians are in bed with the military-industrial complex, we are in trouble. So I'm going to speak now a little bit about the Poor People's Campaign demands. If you are hearing my words, your human needs matter. All of us matter. What does the Poor People's Campaign have to say about our current conditions at this time in history? Our democracy is under attack. These attacks target people of color, especially the poor, youth, and elderly, but in doing so, they strip us all of our constitutional protections. They allow extremists to get elected through voter suppression and racial gerrymandering, and then use their power to hurt people of all races. We have the right to vote and the right to accountable political representation. Immigrants of all backgrounds have the right to citizenship that will afford them a full right to vote and participate in our democracy. First Nations have a right to their political and cultural institutions, lands, and resources. The truth is that the millions of poor people in the U.S. today are poor because the wealth and resources of our country have been flowing to a small number of people, and federal programs are not meeting the growing needs of the poor. That's why we have to create our own systems to meet people's needs. Everybody has the right to live. The U.S. Constitution was established to promote the general welfare. Given the abundance that exists in this country and the fundamental dignity inherent to all humanity, every person in the U.S. has the right to dignified jobs, living wages, housing, education, health care, welfare, a clean environment and food supply, and the right to organize for the realization of these rights. The truth is that economic security, poverty, and misery are affecting more of us. We remain in the dark about who is poor, and this ignorance prevents us from being able to address the broad and deep poverty in our midst. We have the right to know the true state of our union. The truth is that poor communities, especially poor communities of color, are being locked up, sent away, and killed by law enforcement. Equal protection under the law is non-negotiable, and we have the right to move freely without the fear of intimidation, detention, deportation, or death by public institutions which are charged with our safety. The truth is that our policies have not fundamentally valued human life or the ecological systems in which we live. Instead, it has prioritized private, corporate, and financial interests over our precious natural resources. The truth is that the poor live on the front lines of climate change and bear the brunt of costs and impacts of climate volatility. We have a fundamental right to clean water, air, and a healthy environment, and public resources to monitor, penalize, and reverse the polluting impacts of fossil fuel industries. Poor communities are disproportionately impacted by environmental injustice, including right here in Vermont. The truth is that instead of waging a war on poverty, we have been waging a war on the poor, at home and abroad, for the financial benefit of the few. It is morally indefensible to profit from perpetual war. We have the right to protect our communities from the ravages and weapons of war. The truth is that a morality that claims to care for the souls of people while destroying their bodies and communities is deeply immoral. We have the right to ground our public policies and budget allocations in a moral narrative that prioritizes and follows our deepest religious and constitutional moral commitments to justice. So I just want to credit the Poor People's Campaign for the last segments of my speech. I'm grateful for the work that the Poor People's Campaign is doing and to be a part of the Nonviolent Medicaid Army. I feel like connecting with people in our movement is one of the things that sustains me and helps me to navigate the challenges that we face as a collective. Thank you very much.
Thank you. Oh, okay, I have it right here. To echo what Brandon is saying, is the truth is we are all in this together, whether we like it or not. Healthcare is not just about going to the doctor. It is about the food we eat. Is it about our housing? It's about where we live. And it's about people and the earth over profits. Healthcare is a human right. Let's hear it. Healthcare is a human right. Healthcare is a human right. Yeah. Forward together. Forward together. Forward together. Thanks everybody for coming. Looks like they're still serving food. Please come and get it. And don't forget, Workers Center is here. We're always looking for people to join, talking to your neighbor about all the things we talked about today, sharing your story. Let's get organized. Let's eat food.